include Texas. Congressman Ron Paul, Republican of Texas, medical doctor. By the way, he was a flight surgeon in the U.S. Air Force and an OBGYN in private practice. Here in L.A., Dr. Paul Song, radiation oncologist. He supports the president's health care initiative, believes there must be a public option. And in Atlanta, our own Dr. Sanjay Gupta, CNN chief medical correspondent and a practicing neurosurgeon. How will this debate about public access and the like affect you? Will public option affect you, Sanjay?
Well, probably not. In fact, the president has come out and said that people who have private insurance right now, who have access to private insurance, and whose premiums are not above a certain percentage overall of their income aren't going to be eligible for the public option. So there's a lot of people who it won't affect, and I think that's really important there because there was all the sort of talk about people sort of flooding the public option. Not everyone's going to qualify, myself included. You as well, Larry.
Yeah. Dr. Song, you favor it, do you not?
Yes, and I think the big reason is that Milton Friedman, who's an economist that a lot of the conservatives like to quote, in 2001 had an essay that basically said that the third payer system that we have right now was the most cost ineffective system that was available. But since that time, the insurance companies continue to grow. Their overall profits have increased by over 400%, and the premiums have raised by greater than 87% during that time. And I think the big concern is that if we don't have a public option, all you're doing is putting more money into the system that will basically go to the insurance companies without any regulation for patients.
Congressman Paul, if you agree something's wrong and you don't like public option, what do you like?
Well, I'd like to see a little bit more freedom. Most of the time, people do say there's problems, and nobody's denying that, but you know, the problem is that we've had managed care. We've had government manipulation of medical care for 40 years now. So we can hardly say it's the private sector that has caused the trouble. So I would like to see renewal of a spirit of freedom in this country where we can trust the market but not trust the government because the government doesn't deliver. They've had Medicare. It's broke. They have Veterans Care. It's a lousy system. Nobody likes that. People aren't taken care of. But what do? We have rejected the notion of, say, the church hospital. We wiped them out of business. We have Shriner hospitals, 22 of them, that gives free care to all children. And they are having a trouble because of the inflation, because of the cost. So I think our biggest failure in this debate is we have not analyzed where the problems came from rather than just saying, let's go on with more government.
Before I get back to Dr. Gupta, you want to respond?
Yes, I have a lot of respect for Dr. Paul, but one of the things that I think he's saying is incorrect. The idea that the VA system and also Medicare being failures or not being popular are absolutely false. The RAND Corporation, which is actually a conservative think tank, recently published a study that showed excellent satisfaction with the VA system. And the Kaiser Family Foundation actually showed that Medicare is actually run more efficiently with much more dollars going for actual patient care than the private sector. So, and the other thing I want to touch on is this idea of freedom. We have less freedom when you are told by an insurance company where to go, where to get your treatment, what hospital you need to get seen at. Some patients need to drive extra distances because their insurance companies won't let them go to the hospital that's in their own neighborhood. If you had some type of single-payer system, patients would be free to go wherever they wanted. And I would also add, if you're really concerned about freedom, then if you're an employee who's stuck in a job that you don't like, but you're there strictly because of the health benefits, if you had some sort of universal system, you could go to take a job anywhere you wanted.
Dr. Paul, before we get to Sanjay, what do you think of the co-op idea?
Well, if it's private, it's okay, but a government-mandated co-op won't work. But the doctor misinterpreted what I said because he didn't accept the fact that we've had managed government care. So if he says it's not doing well, then you have to blame managed care, the tax code, tort law, how well people can sell insurance across the borders, in the inflationary problems. And I did not say that Medicare didn't work. I said it was broke. And you got to admit that. And here we're putting another program on the government system. The government's broke. We have $2 trillion worth of debt this year. And you think we're going to add this new program and the country's bankrupt. We're not being practical at all by talking about this.
Sanjay, where are you in this?
Well, you know, no one's good at controlling costs here. I mean, that's one thing that's an irrefutable fact. Whether it's a private sector or the public sector, you can't hold up any of these sectors and say, look, this is a good example of how to do this right. And by the way, it's not just the United States. It's around the world where healthcare costs have outpaced inflation in just about every country in the world. So this is something that we're dealing with as a global society, Larry. Whether it's people are using technology more, using more prescription drugs, whether it's chronic disease. You know, we spent over almost $150 billion on obesity-related diseases in this country alone. So, you know, the healthcare is expensive, and I think that's really at the heart of a lot of this. How exactly you pay for it, who's going to pay for it exactly. I think that's where this debate's really centered.
Let me get a break. Still ahead, by the way, later on, Michael Jackson's doctor speaking out.